This programme was produced at and first aired on MPR, Manawatu People's Radio, with support from New Zealand On Air. Ka pai Irarangi Te Motu, MPR.
Kia ora e te whānau, welcome back to RIMA Kōrero. So you're listening to RIMA Kōrero on MPR, Manawatu People's Radio. A big welcome to our listener and a big welcome to our new listener as well. In today's episode, we'll be talking about Integrated Primary Mental Health and Addiction Program at THINK Hauora. So today's guest is my favorite guest because it's my team from Kōrero Access and Choice. We have Vicky and Juliette in the studio, and we also have Lynette tuning in over the phone. You want to say hi, everyone?
Hi.
Hi.
Wyoda.
So shall we just start?
Let's get into it.
Yeah.
Get into it. Okay. So who wants to introduce themselves and their role first?
Oh, I'll go first. Vicky Brown. I am the Service Delivery Coordinator for Kōrero Access and Choice, employed by Mid-Central, but having the privilege of working at THINK Hauora in the primary mental health setting.
Thank you, Vicky.
Kia ora, my name's Juliette and I'm the Project Coordinator of Kōrero Access and Choice.
Cool. Thank you, Juliette. And you, Lynette?
Kia ora koutou. My name is Lynette Laing and I am the Project Manager for Kōrero Access and Choice. Similar to Vicky, I'm employed by another organisation, Te Ora. But yeah, happy to be on board.
Thank you. Thank you for the introduction. So I heard about the IPMHA program. Who wants to start?
Nailed it.
Rocket. Start explaining a little bit about it.
Lynette, do you want to take the lead?
Yeah, I'm happy to kick us off. So the IPMHA program stands for what you've already mentioned, Integrated Primary Mental Health and Addiction Program. It's one of the services attached to Kōrero Access and Choice at THINK Hauora. So for those listeners who are like, who are all of these people and places? Basically, THINK Hauora is our primary health organisation here in Mid-Central. We have a number of different services, health services under that organisation, and one of those is Kōrero Access and Choice. So within Kōrero, our big focus is primary mental health and addictions, and so the IPMHA program is one, I guess, branch off of Kōrero Access and Choice. And for those in New Zealand who have heard about the health improvement practitioners that are based out in the GP setting or the health coaches, that's where this mahi sits within, so the IPMHA program. I'll pass it over to Vicky to elaborate.
Oh, I wasn't expecting that. You did that beautifully. So within the region, so the IPMHA program covers Tararua, Horowhenua and Manawatu, which incorporates Feilding and Palmerston North. And part of that is that we have health improvement practitioners, which we call Mātanga Whai Ora, which are experts in wellness. They are located within GP practices and community and iwi Māori organisations across the Rohi, and they provide brief intervention in those spaces. In the community spaces, they work very closely with community organisations in order to reach a wider population.
And extending on from what Vicky's just mentioned, so we have Tararua, Horowhenua and the Manawatu areas of the coverage, I guess, of where we do the mahi. Yep. So that's in a, I guess, everyday terms. So that's right from Otaki through to Levin, Foxton, up to Feilding, Palmerston North, and then across over to Dannevirke, Pahiatua, and everything kind of in between those spaces.
Oh, so they are based in GP practices?
Yes,
all based?
Some of them are, and some of them are based out in the community.
Okay. So how can the community access the service?
The community can access the service either via their GP, if their GP's got a Mātanga Whai Ora based in the practice. Not all GP practices have yet. It is our goal to eventually be able to reach out into all GP practices.
Yeah.
In the interim, there's also, with some of the organisations around the community that do have the Mātanga Whai Ora in place, we are looking at places like Mana o Te Tangara, Horowhenua Learning Centre, the youth space down there, soon to be Raukawa and Muapoko down in Horowhenua. Otherwise, they can talk to their GP about being referred to THINK Hauora to meet with a Mātanga Whai Ora, and GP can refer directly to THINK Hauora.
Oh, okay, that's interesting. And that's quite easy to refer, right? Like you can just refer directly to THINK Hauora if there's none in the GP practices. Okay.
Would it be helpful, February, if we give you a example of what a Mātanga Whai Ora / health improvement practitioner might do in a session?
Yes, that would be really helpful for the listeners to understand better. Of course.
Oh, cool. So let's say if there's a whole range of things that goes on for any one person. So there could be sleep issues that someone's experiencing, and that could be from a number of reasons, or known reasons, I should say.
Yeah.
Or it could be from a number of unknown reasons and they're not too sure why. If we just use sleep as the example, if you are having issues with your sleep and it's starting to impact on you in terms of over the course of the week it's getting less and less and you're starting to, I guess,
not be able to, not like capable in doing their daily life, isn't it?
Yeah.
It's something like that?
Or, things are getting a bit overwhelming. Maybe it starts to impact on decision-making, all those kind of things. If you wanted to seek some support around that space, this is, again, just one example.
Yeah.
A Mātanga Whai Ora, if you were to sit down with them in one session, they can help with a range of things. So extending on what Vicky mentioned in the brief intervention space, that means that all of our Mātanga Whai Ora and our hips, they have a range of skills in the brief intervention space. So they know a number of skills from different talk therapies, and they can basically sit down with someone and say, okay, let's have a look at what's going on. There might be 10 different things going on. Sleep might just only be one of them. There could be relationship issues, a number of things. What's kind of going on at the moment, and what's one thing that we can work on today in the session that'll actually make a difference. And so sleep is ultimately one of the most important things to start sorting out first.
Yep.
And so our Mātanga Whai Ora do know a number of skills and strategies to help within that space. And we are able to provide not only education, but again, skills and strategies to help manage those issues.
That issue, yeah.
You don't want to elaborate?
Yeah. Oh, okay. So it's like, if it's like stress-related issue or, things that can affect their daily life, but not like if it's like a sickness, right? Am I catching up it correctly?
It can be anything that walks through the door. So our Mātanga Whai Ora are trained to work alongside anything. So a lot of people have the perspective that it's mainly mental health. It doesn't need to be mental health. It could be adjustment. It could be someone recently diagnosed with diabetes who's struggling to come to terms with that diagnosis. It could be someone who's had something happen. So really it's whatever's on top for that person when they walk on through the door. The beauty of the whole model is that it's unlimited sessions. So every time someone can come in with something fresh. And there's no age barriers, there's no cost involved.
So there's no requirement to access the service?
No. We see anyone from 0 to 100 and 100 plus.
Wow.
Any ethnicity. You don't need a community services card. It's whatever walks through the door.
And you don't have to pay?
No. There's no cost involved in being referred. If some people if they have to see their GP for a referral, then of course that comes with a cost.
For the GP.
Yeah. But there is also options of self-referral by contacting THINK Hauora as well.
Oh, okay. So there is that option to self-refer. Okay. Yeah, that's actually very good. And is it like a counseling, or what will happen in the room?
Yeah, no, we're really trying to get away from that whole counselling perspective. It is brief therapy. It is based on a therapeutic modality of acceptance and commitment therapy, but it's called focused acceptance and commitment therapy. So it's a very, very short session of therapy. Not your intensive 1 hour counselling that a lot of people have that perception that's what counselling is.
Yeah.
This is about making behavioural changes, and one slight shift in someone can make all the difference.
Yeah. Yeah. Oh, fantastic. That's actually really interesting. So I can just walk in the door and ask, I'm overwhelmed with work or something, and they can give me like some cognitive behaviour task, something like that.
The whole goal is to improve access, and that's why our mātanga have a certain amount of set appointments a day, but there's also a certain amount per day that are walk-in availability. So the goal is that everyone's seen within 5 days, but there should be ability, where possible, for people to be seen on a same-day basis.
Okay, that's actually, that's very interesting. And about access, so it's about inclusive as well. Like everyone can just walk in and go to the Mātanga straight away if they want to, right? To meet them. Okay. And about the Kaiwakapuaki Wyoda. Someone want to explain that?
Lynette, do you want to take the lead on this one as well?
Sure. So Kaiwhakapuaki Wyoda are our health coaches in the mid-central region.
Yeah.
So our health coaches, there's 11 of them spread across the region. Again, Otaki over in Tararoa, Dannevirke area, and Fielding in the Palmerston North area. So all of our Kaiwhakapuaki Wyoda are employed by iwi Māori organisations.
Yeah.
And their role, they work alongside our HIPs and our Mātanga Whai Ora. And, for example, if we use Fielding, we have a Mātanga Whai Ora who sits in Fielding Healthcare Monday to Friday, and we have 2 Kaiwhakapuaki Wyoda who also spend a couple of days in Fielding Healthcare, and they spend a couple of days outside in their community organisations. So they get the opportunity to pretty much become their own little team, able to work with whānau from right across. Again, so similar to how the Mātanga Whai Ora will see anyone with any issues going on.
Yeah.
There may be some, let's say emotional support. Our Kaiwhakapuaki Wyoda can provide emotional support. So an example of this is, let's say, a elderly male was struggling at home. This is a case from Northland, actually.
Yep.
An elderly male was struggling at home with his wife, who suffered from a health condition. I believe it was dementia. And so often she would disappear from the home space, and ultimately that would trigger alarm bells because she'd be out wandering. So for the male, he ultimately became quite overwhelmed with having to pretty much be on high alert 24/7 to make sure that his wife was safe and that she was okay. But ultimately that impacted on him. And so the Kaiwhakapuaki Wyoda in that situation was able to help sort out some respite care for the wife, and at the same time support the gentleman through emotional support, and ultimately that means she was just able to sit down, have a cup of tea with him, check in on him, and be that support person. So that's kind of their realm of working.
Yeah.
They offer supports out in the community-based setting, because a lot of our work, again, as you would have heard, the HIPs sit inside the practice.
Yes.
So they do a range of things. They might host specific sessions out at the marae, like we spoke about on Monday. One of our Kaiwhakapuaki Wyoda recently held an event out at a marae, and that was for Māori males. So he got them all together with a number of different health services in attempts to pretty much just put their health on the radar for them. So they do a number of things: emotional support, group support, education. Yeah.
It's very interesting that it's about outreaching the community as well. So, not only in-reach and how they can go to like a GP practices and meet someone, but also that you provide an outreach to the community. That's actually fantastic. Wow. So how's the system? Will you get referred from the GP to the Mātanga and the Mātanga to Kaiwhakapuaki, or it's all like, how does it work?
My understanding, and Lynette will take over and correct me if I'm wrong, please, Lynette, is that the referrals to the Kaiwhakapuaki can go direct to the home organisations in which they're employed, which is the iwi Māori providers. There is, although very good links between the Mātanga Whai Ora and the Kaiwhakapuaki, so a number of them do sort of can have that ability to work together. Yep. So there is discussions that can occur between them. So it could be a referral from the Mātanga to the Kaiwhakapuaki, but there's also the option of going through the home organisations.
Do you want to add something, Lynette?
Oh no, that's correct.
Or Juliette?
I'm learning about the whole process at the same time.
Okay. So, before we move further, I would like to go back, because I kind of forgot, to ask about the background of the program. Who wants to explain about that?
I'll give it a go, and no doubt someone can jump in if I miss something out. So the whole background is this whole program sort of rolled out from the Ministry of Health inquiry into mental health services, which identified a few gaps in the delivery of services across the region, or across nationwide really. And following that, there was a pilot project run in Auckland among three services, and this was the health improvement practitioner role, and it was proved to be successful. It improved access, and there was positive health outcomes for the communities in which these people were placed. Therefore, the Ministry of Health, they've rolled that out nationwide. It is a 5-year project, and we are only coming to the end of year 1. And when you think about COVID and the impact on COVID, it actually put a halt on the rollout of the program. So even though we're in year 1, we're probably around 3 to 6 months behind. So given that, we're actually doing fantastic, given we've had that delay in rolling things out, and there's been a real halt on services during COVID, which we know has had an impact on the community at large. So with that, we've got around 13.1 mātanga in place across the region, and the goal is that over the next few years that number's only going to increase. So there's 13.1 mātanga, there's 10.7 I believe Kaiwhakapuaki within the region. So over the next few years you should start to see a lot more access to Kaiwhakapuaki and mātanga within your community spaces.
Okay. Thank you, Vicky. Do you want to add something, Lynette?
No, that's good coverage, Vicky. Great job.
Thank you.
So how does the future looks like for this program moving forward?
Well, I think the future can look quite bright. I think that once we get additional resources and staff or kaimahi on the ground working directly with tangata whai ora, it's only going to improve access, build resilience in the community, and have better health outcomes. The beauty is that it's not just about mental health, and I think it's important that we remember it can be anything. People have that perspective that it is mental health, but really we want to help everybody that comes through the door, and we're hoping to look at groups in the future, looking at how we can run groups in different regions to try and support people with anxiety, or people with adjustment disorders, anything like that. We want to try and build relationships with secondary services as well, so that we can access those services if we need, and pull in that specialist advice from the hospital. So really we're looking at a more integrated way of working within our region, which is only going to improve health outcomes for all.
Wow, that sounds fantastic. Do you want to add something, Lynette?
No, that's good.
Okay. So this program is not only about mental health, but as well as well-being, people's well-being, right? And I remember Te tagline is the path to unlimited possibilities, and it really sounds like it's an unlimited possibilities. We can help them any way possible. It's about inclusion. It's also about outreaching the community. So we come to the end of this episode. Thank you for coming, Vicky, Juliette, and Lynette, tuning in. Hope you enjoy the RIMA Kōrero as much as I do, because I really enjoy this Kōrero and to understand better about the program that we have in the department and the Te Araro Access and Choice. So, and thank you, listener, for listening to today's episode. See you in another episode. Ka kite. Ngā mihi.
Ngā mihi.
So, don't forget to like, subscribe, and click on the bell button so you don't miss out any of the RIMA Kōrero episode. And also, don't forget to share to your whānau. Check out THINK Hauora website at www.thinkhauora.nz. Also, check out THINK Hauora Facebook page and click on the link on the description to give us your feedback on this podcast.
Support this show and others like it by giving a donation. For more information, go to www.mpr.nz/donate.